And actually, I wanted to ask you another question about building on the successes of the Affordable Care Act. And that is that the ACA established the Center for Medicare and Medicaid Innovation to test new payment and delivery models that encourage coordinated care, such as bundled payments. Bay State Health in Western Massachusetts is part of a bundled payment demonstration project, and their private health care system has successfully used this model for years. By bundling payments for hip and knee replacement, for example, Bay State Health reduced the cost of treatment by over $2,000 per patient, while also reducing hospital readmissions and complications. It's not an isolated case. CBO projects that applying bundled payment models like Bay State's nationally could save Medicare about $46.6 billion over the next 7 years. So the Affordable Care Act gave the Secretary of HHS the authority to expand successful demonstrations to a wider range of healthcare providers so that we can cut costs without compromising care or improve care at the same cost. And I just want to ask about your strategic plan for using your statutory authority to expand these efforts where the data demonstrate that we can get better outcomes at lower costs.
With regard to my philosophy, and I think it's important to have things be data-based, having had the opportunity to do grant making in my other roles where one sees and creates models, what I think you want to do is you want to find the models. There are, I think, conditions with regard to which are the most successful and then which are the most likely to scale, because that's what we need across the nation. And you have to consider both questions when considering what you would scale, because what you want to do is get the largest impact you can. That impact is a combination of both what the measures are of success, but it's also your ability to make it go broadly across the nation, and that's how I think about that.
Thank you. The Affordable Care Act gave us tools to help reduce the cost of health care and improve outcomes, and I'm glad to hear that you plan to use them. Thank you, Mr. Chairman.